different tumors at different ages, neonatal, infancy, early childhood, childhood tumors, adolescence, early childhood, middle and late life. Now, there's a book called Death Be Not Drowned. Any of you get a chance to read that? It's a real tearjerker, but it's about a young teen, preteen, who has brain tumor. Graham, I think, is the guy who wrote it. It was about his son. Okay, so congenital tumors do exist. They can also be as a result of injury of the brain at birth. There are metabolic, anoxic tumors that occur in the brain. There are various vitamin and immunochemical deficiencies that can cause it. The most common deficiency that causes brain dysfunction or tumor in the brain is phenylketonuria. Okay, everybody familiar with that one? PKU? All right, every child that's born in the United States gets a test for PKU at birth because almost all our diet drinks and stuff contain chemical compounds that will cause PKU to build up and kill the child. So you have to know that you have the disease so you avoid those foods. And then now we test them within 2 days of birth. They're tested for PKU, usually in the neonatal nursery before they go home. And they send it off to the state. The state does the little paper immunophoresis and can tell you whether or not your child has it. In infancy, you could have various, child spasms or hits your head on the crib and cause a localized benign tumor. Early childhood for the same reasons. And in childhood, sometimes they arrive de novo, or as we like to call it, idiopathic. I love that. These are, I'm sorry, I'm thinking tumors, but these are types of seizures or seizure causes. And adolescents, again, idiopathic. What does idiopathic mean? It means we haven't the faintest idea. That's what it means. And iatrogenic? No. Iatrogenic means caused by the doctor. So you can find iatrogenic disease too. They do weird, dumb things that cause that. Now we're on tumors. Okay. Brain tumors. All right. So the percent in childhood is very high for gliomas. They're the common tumors of childhood. And then some of the more complex tumors like glioblastoma, multiform, is more slanted toward adults. Astrocytoma is the one that kid had on Death Be Not Drowned. He had an astrocytoma. Astrocytomas are uniformly fatal. They look like an astrocyte or like a star. They spread out into the tissue. You can't get them out. Medulloblastomas are a more common childhood tumor. And the other big one you hear about a lot is meningiomas, and those are heavily adult. I guess melanomas are in the other, but in Texas, melanoma is important. Why is that true? Why is melanoma important in Texas? The sun? What about the sun?
Everybody's always outside.
Okay, so no, it's not because it's hot. It's because they cause little melanoma tumors on the skin from exposure to UVB, not UVA, just UVB. So exposure to UVB causes little tumors on the skin, and those skin tumors, unlike other skin tumors, metastasize to the brain. You get a melanoma in your brain, forget it. It really grows like crazy in the brain. And so in Texas, it's very important for all of us that spend time in the sun in Texas, have our skin checked regularly by a dermatologist. If you've got a dark brown or black lesion on your body, you better damn well show it to somebody. Because the melanoma is slow growing, around for years until one day it just metastasizes to your brain. And the next thing you know, you're showing all kinds of symptoms of having a brain tumor. Or you could say, as Arnold Schwarzenegger says, it's not a tumor. Okay, pathophysiology. There are various theories, again, as to why brain tumors form, what they form from. Again, viruses have been suspect. I love this one because it's called the Monroe-Kelly Doctrine. And there's a Monroe Doctrine that has to do with U.S. foreign affairs, so I don't know if they're related, but this says the cranial compartment is incompressible. The volume inside the cranium is fixed. Any increase in volume of one of the constituents, blood, CSF, or brain tissue, results in a decrease in the other. In plain English, what does that mean? A tumor of any kind in the brain is not benign because it's space occupying. If it takes up space, that's space that was occupied by something else. So if you take up space in the cell compartment, then you have less room for the neurons. If that takes place in an inactive side of your brain, you may not even notice it until it gets pretty big. Except that it's a fixed compartment. The pressure can't go anywhere. Where does the pressure go when a tumor gets large enough? It herniates at the base of the brain, and you die. All right, because the brain stems right there, stop breathing. So tumors are always fatal if they're space occupying. Whether they're slow growing or fast growing, a tumor in your brain is fatal unless it's taken out. Now, the nice thing is some tumors, and we'll get to them, are encapsulated and they are easily scooped out. I don't know how easily, I'm not a neurosurgeon, but apparently easier scooped out. Tumors that are invasive, that send off strands into the brain tissue, are impossible to get rid of. Now we have a new technique. Anybody know what the new technique for removing brain tumors is? No? Anybody hear of a gamma knife? All right, the gamma knife is a point of pinpoint gamma radiation that they can now use to cut out a tumor without ever opening the cranium. So, Star Trek, here we come. Okay, you can have tumors that are vasogenic or cytogenic. So, just like you have a tumor in a lung that's bronchogenic, all right, it's from the bronchi. You have a tumor in the lung, it comes from the interstitial tissue. Same thing happens in the brain. It can come from the blood vessels, or the ventricles, or it can come from the tissues itself. Okay, and then we talked about herniation. It comes out the foramen magnum, you're gone. That's it. There is a disease, a syndrome that people are born with congenitally called Arnold-Chiari syndrome. I only know it because it's Arnold something. So. But a patient came to me with it once, and it's a partial herniation of the cerebellar area outside the skull. And you still live that way. It's not fatal. It just means that a sudden whiplash of their neck would kill them. So they got to know the syndrome. They got to be careful about headrests in cars and all that kind of stuff. Matter of fact, it's one of the reasons headrests came back. Okay, this shows how the cells subdivide, form a tumor, push out other things in the brain. Okay, and this shows different places of tumors and what they're called. Number one, one is transfascial. And you don't need to know these. Number two is cerebellar tonsillar. Number three is horizontal. Okay. This is kind of what it is. Clinical presentations, that's more important. Okay. So there's general impairment of cerebellar functions oftentimes. How do we test cerebellar function? Balance, coordination. Your PTs, you should know this. Yeah. So there are cerebellar functions. Don't ask a general practitioner what it is. They don't know. They don't know about running your them. I've never seen a general practitioner do that. I've seen neurologists do it. But yeah, cerebellar function goes first. You may get some balance problems. Then you have a positive romper. Okay, increased intercellular cerebellar pressure, cerebral pressure. How would you measure that? Well, you don't. You got to measure with a catheter. Well, what's a sign of ICP? A sign. A sign is something that you discover. So a headache is a symptom. What's a sign of increased ICP? Papilledema. That's right. You look at the pupil of the eye. So if you go to your doctor's office and he never breaks out his ophthalmoscope, you say, shame, shame. Because he should be looking at your eye grounds and see if you have papilledema. And then there's specific intracranial tumor syndromes. The one that I always love is diabetes insipidus. You guys familiar with diabetes insipidus? It's from a brain tumor, and it causes a water imbalance. So another one that's a big one that I personally had some experience with in New York. The guy came to me complaining of producing milk from one of his breasts. I was like, what? And he says, yeah, I have milk coming. Look, he pushes on his breast and milk comes out. I was like, okay. I was a first-year PA student. So of course I ran in my book and looked it up, and it's due to hyperprolactinemia. Prolactin is produced in the pituitary gland. So when we didn't have CAT scans then, thank you. So when I took a true lateral of his head, which is what you need to do, that means the radiology tech has to line up the ears so they match on the x-ray. That gives you a true lateral. When you do that, you can see the sella turcica, which is where the pituitary rests. And when you have a pituitary tumor, it erodes the sella turcica. So you see a sella turcica that's partially eroded. That shows you that it has a pituitary tumor. And he did, he had a pituitary tumor. First one I went to my doctor and said, he smokes too much grass and that's why he's got it. Because that can cause it too, but that's not why he has it. So male lactation is definitely one of those, although female lactation outside of the birth cycle would be one too. So you may see patients like that or hear of patients like that. They're producing breast milk and that's from a pituitary tumor. Pituitary tumors are operated intracranially. How do they do that? They go through the ethmoid plate. Where is that? Your nose, right. So they go up with instruments through the nose and operate. Now, of course, they can do it with a scope. Before fiber optics, they did it blind or with fluoroscope. So, okay, so signs and symptoms of cerebellar function, headaches, seizures, there are changes in mental function, there's psychomotor problems, there are, the headaches are usually nocturnal, they're nocturnal heading into early morning, so they'll wake up with a headache. Vomiting and dizziness because of the increased ICP, they get the vomiting. The vomiting is projectile. Some of you that have infants know what projectile vomiting looks like. That's where they throw up and splatter it on the wall. Okay, that's projectile vomiting, and they can have seizures. First seizure in adulthood should suggest a tumor. That's one of those until proven otherwise things. If you have an adult that seizes for the first time, it's probably not epilepsy. If they've not had head trauma, it's probably a tumor. Okay, this is glioblastoma multiforme, or GBM. It's the most common and most aggressive malignant tumor of the brain in human beings. It's peculiar to middle adulthood, and it's characterized by small areas of dead tissue that surround aplastic cells. So usually on autopsy, that's how they find that out. I can't really do a brain biopsy of something that big. Usually forms from white matter, grows quickly, and can become very large before producing symptoms. That's because our brain's highly specialized. So if a tumor forms in an area that we're not using, we won't know. They're highly malignant, and the 5-year survival rate is 0. All right, somebody tells you you got a GBM, you're dead. Some of these arrive from the meninges, and they're benign, but nothing's benign in the brain. Okay. Altered mental status is often the first presenting sign. Irritability, decreased alertness. Periodic frontal and occipital lobe headache. Don't think if you have the headache as a tumor though, because it's not a tumor. All right. Projectile vomiting is bad. If you've got projectile vomiting, that's not GI distress, that's something else. Unsteady gait. Sphincter incontinence is also quite common. And papilledema. If they have all of these and the doctor doesn't recognize they got a patient with a brain tumor, probably need to go back to medical school. Okay. Medulloblastoma is in either the third or the fourth ventricle. It's a cyst-like tumor. It would be considered benign except that it's space occupying, and so it's considered to be highly malignant because it grows so quickly. It's a primary brain tumor. It doesn't originate from elsewhere. Usually starts in the cerebellum or the posterior fossa of the brain. There are sub sections of these, but I don't think you really need to know about it. And the Monroe-Kelly doctrine comes from the fact that there's actually a foramen in the third ventricle called the foramen of Monroe. Here's what papilledema looks like. So if you ever have a chance to look at eye grounds, you can see what a stage 4 papilledema looks like. I've never seen a stage 4. What's going on here is that the blood vessels are engorged. And if the blood vessels are engorged in your eye, you can't see. So that's what's going on, and that's what that looks like. The disc is actually bulging toward you, and that's why it looks like that. If you had papilledema that bad, you probably wouldn't even be conscious, so I don't think you'll ever see one of those. Okay, and here's a MRI, and as stated before, you can see it's in the posterior fossa, and that's a bad place in the brain because what's this? What's that?
We
Whoops.
can't say.
Go back. Oh, the arrow. What is that?
Brainstem.
The brainstem, that's right. So you think that brain tumor might be affecting respiration, temperature, pulse, everything? Yeah. And is that operable, you think? No. Look at that one. That's an intracranial tumor. And that one's actually sitting in the, what's that? Huh? Or more particularly, it's in the red nucleus. So that's a tumor of the red nucleus. These are real MRIs from somebody, probably somebody who's not alive, but somebody. Okay, here's one that I've seen personally that's kind of interesting, an acoustic neuroma. An acoustic neuroma can sometimes be seen through the ear when you're looking at the drum. I don't have a picture of that because this isn't really designed for clinicians per se, but there are signs that an individual may be developing or have an acoustic neuroma, the eardrum is amobile. So when you look at somebody's ear, you ever notice that the doctor has a little suction bowl on the end of his otoscope, especially if he's an ENT, and they squirt it? What they're doing is they're looking at the drum moves. The drum, all of a sudden the drum doesn't move. It's immobile. It's rigid. That's one of the signs. I know another one, and this one you should mark down somewhere. It's not on the lecture, but a cholestoma is a precursor of an acoustic neuroma. And cholestomas are seen as a big black blotch on the eardrum. And they're formed almost entirely from cholesterol. But they form this little ball of waxy stuff, and that eventually stimulates an acoustic neuroma. All right, there's loss of hearing with acoustic neuroma, headache. There's vertigo is the most common presenting sign. There's unsteadiness of gait because of the vertigo and also because of ataxia. There may be facial pain. Tinnitus is another highly common presenting sign. Tinnitus is what? Ringing in the ear, right? And facial weakness of which cranial nerve would cause facial weakness? 7. That's right. Okay. So it says that it's interesting because this says symptoms in order of appearance, and then it says signs, and some of the signs are the same as the symptoms, right? So hearing loss is a sign. That's also probably a symptom. See, it says loss of hearing up here, and then it says hearing loss. That's, I think, the same thing. Okay. Facial weakness is a sign, but it's also a symptom. Sensory loss is a sign, and gait abnormality could be a sign or a symptom, and unilateral ataxia would be a sign. So, does it matter whether it's a sign or symptom? No. If any of those show up, you need to think about it. Here's an acoustic neuroma. And lo and behold, it sits right on which nerve? Pardon me? Statoacoustic nerve, right? Okay. If I say syllable instead of syllable, it's because I'm from New Jersey. Okay. In other words, my pronunciation is, of course, may be different. Specific intracranial tumor syndromes that show up for different types of tumors. I already told you all about the pituitary tumor. And that increases with age, 20% at age 80. So if you have an 80-year-old with breast milk, probably has a pituitary tumor. Or he's smoking a lot of grass. Depends if he's from Colorado or not. Hormone-secreting tumors are fairly common. Prolactin is the most common, 70%. That's what I just told you about. Growth hormone is also common, and ACTH. There are two types of microadenomas and macroadenomas, and what that means is, what is an adenoma? Break it down by your technology here, medical dictionary. Adenoma means like glandular adenoma. Glandular cells, if you remember from, I don't know, did you guys have histology? Okay, well, they're tall columnar epithelium arranged in a ring around the central tumor. That's an adenoma. An adenomatous tumor looks like that. All the cells are lined up like a pinwheel. Okay. I unfortunately have taken histology twice, so I actually know what things look under a microscope. But interestingly, the federal government, in their infinite wisdom, decided that medical practitioners don't need to be able to look at a microscope. So they took them away from us. There's a clear regulation that says you can't have a microscope in your office. Isn't that nice? Okay. Symptoms are hormonal. You can have amenorrhea, galactorrhea, impotence, acromegaly, Cushing syndrome. Any tumors can produce any sort of thing that our body produces. So we get an overproduction of steroids. What do we get? Cushing syndrome. Okay. Headaches always. Visual field testing is important. Anybody know what a visual field test is? You ever seen one? Take your hands and you go like this. You have the patient look at your nose fairly close up, and then you bring your hands in until they can see the fields. You'll see a deficit in the visual field, not even noticeable necessarily by the patient. Just won't know. All right. That's a nice picture of, this is not a good view for the Selatursica, but you can see it. It's not normal right there. Right? Darn it. It's right there. That's not normal. That Selatursica is worn in the center. Okay, that's a nice busy slide. These are remote effects of malignancy of the nervous system. It's pretty much everything you can think of, so I wouldn't worry about it too much. Now we're going to talk about infections.